Doctor, please, can kissing transmit AIDS? Most studies have said that the likelihood of transmitting AIDS through cold sores is almost non-existent, meaning through the exchange of saliva in cold sores. The studies have said that this possibility is nearly non-existent. Welcome. Please, doctor. Tell us about AIDS. How is it transmitted? What are its symptoms? What tests do we do to find out if we have it or not? Tell us what treatment can be taken. Let's start the story from the beginning. What exactly is AIDS? Acquired immunodeficiency disease doesn't occur on its own. For it to happen, you must first be infected with a virus called HIV. And that's a big difference between the two. The virus that causes AIDS is called HIV, and it's possible for people to get the virus without developing AIDS. That means some people can take medication that controls the virus. Their immune system can remain healthy for their entire lives, and they can live normally without their immunity ever weakening, and that's a major difference between them. As we said, HIV is the virus that, if someone gets it and doesn't take their medication, after months or years their immune system can start to weaken, and they develop acquired immunodeficiency, which is called AIDS. So how is it transmitted, doctor? Now, this virus, everyone, is transmitted through body fluids, like blood and semen, that is, through unprotected sexual relations or through blood contact. It can also be transmitted through breast milk or from mother to baby during childbirth or even before birth. Therefore, all pregnant women are tested for HIV at the beginning of pregnancy, that is, before the due date, so we can know whether they have the virus or not. Okay, so we said it's transmitted through semen and through blood, so how does blood contact happen? God forbid if someone uses contaminated needles, and this isn't something we usually find among ordinary people. We might find it among some drug addicts who share needles, but this has become rare nowadays because people are now aware not to use syringes that someone else has used. However, it's important to clarify this point. Or, God forbid, if someone receives a blood transfusion from someone who wasn't tested, he didn't know if he had viruses in his blood or not, because it's blood without knowing what's inside it. And this is difficult to happen, because in all blood banks, any sample or any donated blood is tested for viruses so we can know whether the blood is safe or not. And if there's a problem, the blood is destroyed and the person is notified so they can start treatment. This is also rare, but it's important to clarify this point as well. Okay, what about through body fluids, doctor? I mean, if I have sexual intercourse with someone and I'm not sure whether they have it or not, and no protection was used, then there is a risk of transmission. Doctor, please, can kissing transmit AIDS? In fact, most studies have shown that the likelihood of transmission through kissing is almost non-existent. That is, through the exchange of saliva while kissing. The studies have said that this possibility is nearly non-existent. Okay, doctor, please. Now, I go to the barber and get shaved with his razor, with his machine. Can the barber's tools at his shop transmit AIDS to me? Studies have said that this possibility is almost non-existent. Okay, please, doctor. I go to the dentist and I'm afraid his tools might transmit AIDS to me. Can that actually happen? Studies have also said that this possibility is almost non-existent because all doctors sterilize their tools. For this to happen, for there to be a chance of transmitting something through the tools would have to not be sterilized at all or be washed with contaminated blood. And of course, that's impossible. So we really don't worry about these three scenarios nowadays. In the past, we used to be terrified of them until studies came out and provided numbers, showing whether the likelihood of transmission was weak or strong. Alright, doctor, now I just want some reassurance, please. I want to know whether it was transmitted to me or not. I mean, if anyone had unprotected sex, or God forbid, used something and is worried whether there was blood involved or not, what can they do to find out if they have HIV or not, if it was transmitted to them or not? Let's go through it step by step. The first test, which is the most accurate and the most expensive, is called PCR. PCR RNA. This test detects the virus itself. And we can't do this test until at least 10 days have passed since the suspected exposure. So, if someone had sex and comes to talk to me in the clinic and says, "Doctor, I had sex a week ago or 5 days ago, please tell me the name of the HIV test because I'm worried," I tell him we can't do it. At the very least, 10 days have to pass. The more days that pass, the more accurate the result will be. Its accuracy is over 98%. Alright, let's go down one step after that. The next one is called the combo or fourth generation test. This test detects the HIV antibodies and also a part of its protein product. This one can be done at least 15 days after suspected exposure to infection. Let's go down another step to the third generation tests, which only detect antibodies. They're less accurate, and we can't do them unless at least 3 weeks have passed. We go down one more step to the rapid test, which is done and gives results in 15 or 30 minutes. This is what we call a point-of-care test. It's done from a finger prick or a sample taken on the spot, and it's analyzed while you're standing in front of the lab or the doctor. This one is less accurate. Its accuracy is lower than all the others. We don't recommend it to anyone, and to do it, at least a month should have passed since the suspected exposure to infection. So, for most people, we recommend the combo test. It's not as expensive as the PCR, and you can do it after 15 days. So doctor, if I did the test and it came out negative, do I need to repeat it again? Yes, you need to repeat it again after 3 months from the suspected exposure to infection. But why, doctor? Weren't you saying 10 days and 15 days? Yes, everyone. We're saying at least 10 days for the PCR and at least 15 days for the combo test, but not at most. So if we do the PCR after 10 days and it comes out negative, of course, the likelihood that it's still present is extremely low. But just to be sure and to reassure the patient, we tell them, please repeat the test again in another 3 months, or make sure that 3 months have passed since the incident you suspected might have transmitted the virus to you. This point is important, and we used to get a lot of questions about it, so we wanted to address it in the video. Okay, doctor, is HIV treated when someone gets it and is diagnosed? Yes, there are medications prescribed by infectious disease doctors who are available in fever hospitals across the country and in all Arab countries as well. They can prescribe medications and conduct regular tests for the patient to make sure that there is no viral activity and that their immunity always remains good. They also inform patients about certain precautions they should take so they can live their lives like everyone else. They can get married, have children, and live their lives just like everyone else with some special precautions because they have HIV in their bodies. So doctor, if we discover that a pregnant woman has HIV early in her pregnancy, are there any medications that can help prevent it from being transmitted to the fetus? Yes, there are medications that do that and reduce the chance of transmission to the fetus, and this is one of God's mercies upon us. Thank God that this exists. That's why all pregnant women are tested for hepatitis viruses and HIV at the beginning of pregnancy, in addition to other tests. Everyone who comes in for surgery is also tested for viruses and HIV. Why do we do this? Because during surgery, there will be doctors working and there's a chance someone could get pricked, even if they take precautions, which could lead to transmission of infection. Therefore, it's very important for anyone undergoing surgery to have these tests done. That way, if we discover anything, there are specific precautions that are taken in the operating room to prevent anyone from getting infected. Also, if the patient is found to have something, they can start treatment right away and not end up developing AIDS. Okay, doctor, does HIV have any specific symptoms that would help me recognize it if I experience them? Yes, but unfortunately, they're similar to the symptoms of a respiratory tract infection. And sometimes they can resemble the symptoms of a gastrointestinal infection. So the patient might get a fever, might have back pain, or feel hot. Severe physical pain, intense headaches, and sometimes the lymph nodes in the body start to swell. Some people experience diarrhea, vomiting, or fatigue. That's why the symptoms aren't very specific to HIV alone. These symptoms occur with many infections, but what makes a doctor suspicious, along with the symptoms, is the patient's medical history. If you have done something that involves behavior which could raise suspicion of transmitting this virus, tell your doctor. For example, if you had unprotected sex with someone you don't know, that is, a sexual relationship without using a condom, or if a condom was used but broke, or if you received a blood transfusion recently, or if you used syringes that you knew were not clean. If you took an injection with a syringe that you knew wasn't clean, then you should inform the doctor that you had such an incident, because along with your symptoms, the doctor will then suspect and request the necessary tests. So, God forbid, if you get tested and discover by chance that you have HIV, or if you were suspicious and got tested and it turned out you have HIV, what should you do? Go to an infectious diseases specialist at the nearest hospital, get their opinion, and show them your test results. They will do a confirmatory test at the hospital, start the necessary precautions for you and your close contacts, set up your medication plan, and give you advice on prevention so that the infection doesn't spread to anyone in your family. The people living with you will also be given medication to make sure the disease or virus doesn't get transmitted to them. We also give them advice that, if followed, makes the chance of transmission very low. That's why I want to reassure everyone. HIV has medications, and not everyone who gets HIV develops AIDS. This is a virus that has treatments, and that's a mercy from God. Most people who take the medication do not reach the stage of AIDS. We have now pretty much covered all the information about HIV and AIDS in this video. If you have any questions, write them for us in the comments, and we will respond to them in a video, God willing. I hope the video was useful. If it was helpful for you, don't forget to hit the like button. Share it with anyone who might benefit from the information inside. And if you haven't subscribed to the channel yet, please do so to get all the new videos. See you soon.